It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's podcast, I've published an interview with Charlie Atkinson, who overcame numerous challenges as a long-term intensive care patient, survived against all odds, and also helps currently his daughter-in-law to manage her prolonged ICU stay. You can check out the interview last week with Charlie if you're clicking on the link below this video. In this week's blog, I want to talk to you about having a loved one critically ill in intensive care, why your resolve matters. Before I get into today's topic, I want to share a quote with you that I wrote on today's topic, and the quote says, "Resolve matters. You always need to know and focus on your outcomes and goals when your loved one is critically ill in intensive care." Most families of critically ill patients in intensive care get too carried away by their emotions instead of focusing on what they can control. Having resolve is an attribute and a quality you can and must control if you are determined and persistent. Most families of critically ill patients in intensive care start projecting their fantasy on what they want onto the intensive care team, while ignoring the reality. This reality is often a harsh reality once families realize that the intensive care team more often than not have their own hidden agendas. This leads to tremendous suffering down the road and painful experiences once families of critically ill patients in intensive care realize that they don't share the same goals and values as the intensive care team who they initially trusted blindly. As hard as it can be sometimes, you must see the intensive care team and your critically ill loved one's circumstances for who and what they really are, instead of better than they are, in order to make smart choices and the right decisions. So, 99% of the families of critically ill patients in intensive care will never have peace of mind, control, power, and influence. Those 99% of families of critically ill patients in intensive care have also consciously or unconsciously chosen to give away any power that they may have had in the first place to the intensive care team by consciously or unconsciously seeking approval. Big mistake. The thought that they can have peace of mind, control, power, and influence has never and will never cross their mind. The thought, thankfully, you have come to this website, and given that you are now immersing yourself into this video or podcast, into some of my other free and paid resources, you have probably realized by now that not getting the outcomes that you want for your critically ill loved one is simply not an option. You have probably realized that there are many things that you can control whilst your loved one is critically ill in intensive care. One of the things you can control is obviously your resolve to get what you want, to get peace of mind, control, power, and influence quickly. However, the 99% of families of critically ill patients in intensive care have again given up the minute they entered the intensive care unit and the minute they started seeking approval to the intensive care team. You know by now that you are very different, and you know by now that it's a matter of your resolve, your determination, your negotiation skills, and by you standing out from the crowd in order to get what you want and get peace of mind, control, power, and influence quickly. You know by now that just simply being here with me on this video, by being a subscriber to my regular updates and blog, and by simply consuming some of my free and paid resources, you are on your way to master this once-in-a-lifetime challenge that you know you can't afford to get wrong. Your resolve to do whatever it takes is what carries you through this massive challenge when your loved one is critically ill in intensive care. Now, I can give you numerous examples that I encountered during more than 15 years intensive care nursing experience in 3 different countries, where I literally worked with thousands of critically ill patients and their families, and where I also worked for more than 5 years as a nurse unit manager in intensive care, where the only thing that saved families in intensive care and their critically ill loved one was their resolve, their determination and their persistence to do whatever it takes to get peace of mind, control, power and influence. When families of critically ill patients in intensive care approach me to get one-on-one consulting with me via Skype or over the phone, the one quality that they often all have in common is that they have the resolve to get peace of mind, control, power and influence quickly, no matter what. So, no matter how difficult, challenging or heartbreaking your family's and your critically ill loved one's situation may appear on the outset, and even if your critically ill loved one is in a situation where they are either very unstable and in a very critical condition, or they are in a life-threatening situation, or they are in intensive care for long-term treatments and long-term stays, including long-term ventilation, or they may be having a severe or traumatic head or brain injury, or your loved one may be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order. Or your loved one may be in a situation where the intensive care team suggests a withdrawal of treatment or a limitation of treatment as being quote-unquote in the best interest of your critically ill loved one. Or your critically ill loved one may even be approaching the end of life in intensive care. The fact of the matter is that no matter how much doom and gloom and how much negativity the intensive care team has given you about those situations that I just mentioned, know that your resolve and your determination matters and is often more important than anything else. You don't need to buy into the negativity of the intensive care team, and you don't need to listen to the doom and gloom of the intensive care team if you decide not to do so. By now, you may know that there are way too many things happening behind the scenes in intensive care that hold you back from peace of mind, control, power and influence. And by now, you know that often the positioning of your critically ill loved one's diagnosis, prognosis and the treatment they have been offered or not offered is a direct result of what's happening behind the scenes in intensive care that only insiders know. Your resolve is what matters the most, and it's often the only thing you can control. Mix your resolve with my expertise and you have a powerful recipe and ingredients to get peace of mind, control, power and influence quickly while your loved one is critically ill in intensive care. So, how can you accelerate your resolve and how can you get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. 5 mind-blowing tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, where I answer your questions, or send me an email to support@intensivecarehotline.com with your questions. Or you can call us, find phone numbers on our contacts tab. Also check out our product section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one consulting with me via Skype or over the phone by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.